Hello, dental professionals out there. This is Dr. Leath speaking. I'm in my car and I'm on my way home. I wanted to talk to you about hourly goals and being productive inside the office. For the dental providers, have an hourly production goal. For the hygiene providers in the office, have an hourly production goal. Doesn't matter if you're there an hour, you're there 8 hours, have an hourly goal. There's a company called Productive Dentist Academy, and this is in no way a sponsorship of their company, although I have gone through it and I absolutely loved it. Encourage you to do it, but they're not paying me to say this. They figured it out. They've cracked the code. They have their dentists working with 3 assistants, where there's 2 columns as production and a separate column, a third chair for non-production. And their whole idea is, hey, whatever you want to make per year, work backwards. Of course, you take into account overhead, but work backwards from that, and that's what you schedule for hourly production. And there's a whole format in doing it, and there's like basically a block schedule and all of that. But if you don't do it, and you just have 2 columns that you're dovetailing, you're going to be productive, but you're not going to be as productive. And ever since I started doing this, I consider myself a high producer. Like a million a year in production. And that's just like, restorative dentistry. We're not talking like all on 4s and everyday IV sedation kind of stuff. That's just restorative. And if you have a schedule like that where you don't have any other skills like implants or IV sedation or Invisalign, shall we say, the higher ticketed items, then you're gonna kind of bust right up between 800 and a million if you're a high producer in terms of what you can produce. But you can be much more productive if you don't dovetail and you have 3 assistants working for you. So have that hourly production as a goal and schedule to production. Okay? So if I have a procedure that's, let's take something restorative, 2 crowns, and it's $1,800 a crown, that's $3,600. And let's say my goal per hour is $1,200. Well, I'm scheduling 3 hours in that 1 column for it. And I'm putting other things alongside of it where I'm not stressing myself out. There's a format to do this. But is it going to take me 3 hours to do that? Of course it's not. My team knows that, but they still block it out. It gives me time to do hygiene checks. It gives me time to do other things, go into another chair, etc. So it's got to be scheduled properly. But I'm telling you, if you work your way backwards and reverse engineer it, you'll be very, very, very happy you did, because you'll have less stress and you'll be more productive. Do that same thing with hygiene, whatever that looks like. Give them an hourly production. And at the end of the day, have someone on your team responsible of entering it into a scorecard. So when you come into the office the next day, you know the trends. Hey, did I hit my hourly production goal? If I didn't, how can we pivot and do something different that's for the better? So word to the wise, schedule to hourly production goals. Hope that added value to you here, and I will see you guys on the next Dental Passenger Talk.